7 Personal hygiene mistakes elderly patients often make without knowing the risks. As we age, maintaining personal hygiene may seem routine, but many elderly individuals are unaware that certain hygiene practices can signal serious health conditions. These habits, often brushed aside or deemed inconsequential, can be early warning signs of hidden threats to one's health. In fact, doctors frequently observe these mistakes in their elderly patients, and addressing them is essential for safeguarding health and well-being. While this information isn't typically taught in schools or discussed in medical offices, it plays a crucial role in determining whether seniors can enjoy their later years in good health or face avoidable health issues that strip them of their independence and dignity. Here, I'll reveal the 7 critical hygiene mistakes often made by elderly individuals, provide insights from real-life stories, and suggest simple remedies that could potentially add years to life. Mistake 1: Neglecting oral hygiene. How often do you inspect your toothbrush? Is it frayed? Are you brushing thoroughly twice a day? Surprising to many, inadequate dental care goes beyond just bad breath or tooth loss. Research from geriatric specialists at Harvard Medical School indicates a direct link between poor oral hygiene and serious health issues like heart disease, strokes, and even dementia. Bacteria from untreated gum disease can enter the bloodstream, resulting in severe heart conditions. In fact, seniors with poor dental hygiene face a 3-fold increase in cardiovascular problems compared to those maintaining their oral care. Consider Sylvia, a 68-year-old retired teacher who neglected her bleeding gums for months. Thinking it was a normal part of aging, she was shocked during a routine physical when her cardiologist identified dangerous inflammation in her heart valves caused by oral bacteria. Had she delayed getting help, it could have been catastrophic. To maintain oral health, examine your toothbrush regularly. If it's over 3 months old or showing signs of wear, replace it. Switching to an electric toothbrush is ideal, as studies show they can remove 62% more plaque than manual toothbrushes. Brush for 2 minutes, twice daily, and floss every night without fail. Also, don't skip dental checkups, even if you're wearing dentures. Bleeding gums or swelling shouldn't be ignored. These signals warrant immediate attention. Mistake 2: Infrequent bathing and lack of skincare. When it comes to bathing, many seniors may reduce their frequency as they age. However, your skin, as the largest organ, is a critical indicator of internal health. Dermatologists at the Mayo Clinic have found that infrequent bathing in seniors can often mask early signs of issues like diabetes, liver problems, and cardiac conditions. Alarmingly, nearly 40% of undiagnosed medical conditions in seniors could be detected through proper skin observation. Take Clarence, a 77-year-old retired postal worker, who believed bathing once a week was sufficient. During a visit to his doctor for an unrelated issue, unusual skin discoloration led to tests revealing early signs of kidney disease. Regular bathing can help uncover these kinds of symptoms early on. To ensure proper skin health, establish a bathing routine of at least 3 times weekly, even if you're not particularly active. Use mild, fragrance-free soap to avoid stripping the skin of its natural oils and apply moisturizer while your skin is still damp. Regularly check for any unusual changes in skin texture or color. Persistent itching or dry patches can signify deeper health issues. Mistake 3: Ignoring nail care. Take a close look at your fingernails and toenails. Are they well trimmed and clean? The health of your nails can provide insight into your overall well-being. The American Academy of Dermatology has noted that changes in nail appearance can indicate over 20 systemic diseases, ranging from anemia to heart disease. An example is Beatrice, an 82-year-old woman who noticed her toenails thickening and yellowing but thought it was just a part of aging. When she consulted a podiatrist for foot pain, it became clear she had a long-standing fungal infection that pointed to a severely compromised immune system. Further testing revealed a serious underlying condition. Make nail care a priority by trimming nails regularly and keeping them clean and dry. Wear breathable footwear and change socks daily. Pay close attention to any changes in nail color or texture, as these can be crucial signals from your body alerting you to potential health concerns. Mistake 4. Improper management of incontinence. Possibly one of the most overlooked hygiene issues among the elderly, improper handling of incontinence is a common problem that many are embarrassed to discuss. Research from Johns Hopkins Medicine shows that untreated incontinence can lead to severe skin infections, falls, and even mask serious conditions like bladder or prostate cancer. Seniors who adequately manage incontinence experience 60% fewer complications than those who attempt to conceal the issue. Douglas, a 73-year-old retired accountant, was too ashamed to mention his leaking problem to his doctor. He thought he could manage it alone with makeshift solutions, but eventually, he developed painful sores, leading to the discovery of an advanced prostate issue that could have been addressed much sooner. If you face any form of incontinence, don't shy away from discussing it with your healthcare provider. Use proper absorbent products meant for incontinence and change them quickly when wet. Ensure a good cleansing routine to prevent skin breakdown. Remember, incontinence is not a natural part of aging, it often indicates a need for medical evaluation. Mistake 5. Errors in ear hygiene. Let's look at ear cleaning practices for a moment. Many seniors engage in dangerous habits such as using cotton swabs deep in the ear canal. This can damage hearing and obscure symptoms of severe infections. Otolaryngologists report that improper ear cleaning causes nearly 40% of ear canal injuries among those over 65. Patricia, a 71-year-old retired librarian, frequently used cotton swabs until she punctured her eardrum, leading to an infection that required emergency treatment and resulted in permanent hearing loss. The appropriate way to care for your ears is straightforward: never insert anything smaller than your elbow into your ear canal. Clean only the outer ear with a warm, damp washcloth. If you have excess earwax, use softening drops instead and consult a doctor if you notice any pain, discharge, or changes in hearing. Mistake 6. Poor foot hygiene. How often do you check your feet? Really check them. Your feet can reveal significant clues about your circulatory and nervous systems. Podiatrists specializing in geriatric care emphasize that foot hygiene can often indicate early signs of diabetes, neuropathy, and vascular diseases. In fact, studies suggest that proper foot care and regular inspection could prevent up to 85% of amputations related to diabetes. Consider Raymond, a 76-year-old retired factory worker, who ignored minor cuts and dry skin on his feet, believing they were just natural aging signs. When a doctor noted the condition during a routine examination, diabetes testing revealed the disease in its early stages. If those signs had gone unmonitored, Raymond could have faced severe consequences. To care for your feet, wash daily and thoroughly dry them, especially between the toes, where fungi thrive. Inspect for cuts, sores, or changes in color or temperature, and wear clean, dry socks made of breathable materials. Never dismiss pain, numbness, or wounds that aren't healing. They could be red flags demanding immediate medical attention. Mistake 7. Medication-related hygiene issues. Assess your medication routine. Are you taking multiple prescriptions? Have you recently noticed changes in body odor, sweating patterns, or dryness in your mouth? Certain medications, while necessary for health, can cause hygiene-related issues signaling dangerous side effects. Pharmacologists reveal that almost 40% of adverse drug reactions in seniors manifest as changes in personal hygiene before more severe symptoms arise. Take Barbara, a 67-year-old retired nurse, whose unusual body odor was dismissed as poor hygiene until her doctor identified it as medicine toxicity impacting her liver. She explained, "I shower regularly and use deodorant. I never imagined that the scent was coming from my body." To protect yourself, monitor any hygiene changes after starting new medications. Keep a simple journal tracking differences in body odor, sweating, or any skin conditions. Stay hydrated, as advised by your healthcare provider, and report any unusual changes to your doctor immediately to avoid potential drug interactions. Conclusion. Now you know the 7 critical hygiene mistakes often seen in elderly patients and how to rectify them. By addressing these concerns today, you can prevent serious health issues, maintain dignity and independence, and potentially extend your life. Remember, good hygiene transcends mere appearance, it's a vital component of sustaining health into old age. If you found this information insightful, consider sharing it with friends and loved ones who are over 60. This knowledge could significantly benefit their health, perhaps even saving lives.